Hello everyone, this is Dr. Uma. Today I'm going to discuss about how to identify the congenital malformations of the newborn. Also, how to manage, how to provide nursing management for those newborns. It's about comprehensive overview of congenital anomalies with focusing on especially how to identify, find out the causes and nursing care. First of all, we need to understand what is congenital malformations. Okay, so what is congenital malformation? It's a structural, functional, or metabolic abnormalities present at birth. If we need to note the word present at birth, any structural or functional or metabolic abnormalities identified or present immediate after birth, which is called congenital malformations. Okay, so this is especially developed during the intrauterine life, particularly during the time of organogenesis period. So what is organogenesis period? It's a period between 3rd to 8th week of gestation. Organogenesis means during the this time only organs of the fetus gets developed. Okay, that is called the organogenesis. Organogenesis in the sense organ means organs, genesis means development. Okay, during the time of development of the organs of the fetus, this is called organogenesis. So congenital malformations develops during that time only. Okay, and these anomalies most of the time can be detected with antenatal screening. Otherwise, at the time of birth, during the physical examination, in some conditions later in life also some of the congenital malformations can be detected as per the appearance of the symptoms. And congenital malformations are very significant contributor in increased infant mortality and of course long term disability. So here early detection is having very important role. Through the early detection, we can improve the survival rate and the quality of life by appropriate care. Next, we'll see about causes and risk factors. Especially four causes are involving. Among all the causes, the first causes is the genetic causes only. It means due to some chromosomal abnormalities such as Down syndrome, Turner syndrome can cause the congenital anomalies. Even single gene disorders, family history of congenital anomalies also one of the causes of the congenital anomalies. The second one is the environmental causes. Due to maternal infections like rubella, syphilis, we can say torch complex, and drug exposure of the mother, especially alcohol, anticonvulsant drugs, and thalidomide. Then radiation and toxic chemical exposure of the mother also can cause a congenital anomalies. So then maternal factors means pre-existing diabetes mellitus. It means before the pregnancy, maybe mother is having any diabetes, and if she takes poor nutrition, otherwise if she is having folic acid deficiency or advanced maternal age, I mean more than 35 years. These are the also some of the risk factors congenital anomalies can happen. And fourth cause is the unknown causes. So despite advance in medical and science, many congenital malformations have no identifiable cause. Most of the time unknown cause plays vital role here. This is about classification of congenital malformations. See, the congenital malformations are classified on the nature and the systems they affect. Okay, so understanding the classification help the nurses to provide targeted care and anticipate specific complications also. So the first one is the structural malformations. So name itself we can identify that is visible defects in body structure affecting physical anatomy. It, for example, cleft lip and cleft palate or spina bifida or congenital heart disease. This is specially anatomy related one. Structural malformation in the, it can affect the body structures. Second one is a functional malformation. Here body will be normal but the functions of the body can be affected. For example, metabolic or biochemical abnormalities. Okay, especially ketonuria. What is phenyl ketonuria? This is one of the biochemical or metabolic abnormalities of the body actually. Here what is happening, breakdown of phenyl alanine getting disturbed, so it can cause irreversible intellectual disability or seizure or any other thing like musty order of the body can be happen here. So third one is the single system defects. So here anomalies confined to only one or one system only. Okay, isolated cardiac defects, it means only congenital anomalies present only cardiac, otherwise sometimes respiratory, otherwise sometimes renal system. Second, I mean fourth one is the multiple system defects. Here complex syndromes involved in multiple organ, sometimes like Down syndrome, it can affect various body parts. Okay, this is called a multiple system defects. This is about how to identify, otherwise diagnose the congenital malformation. Okay, so always a timely detection of congenital malformation is very important. They help to for the nurses and physician to plan and provide appropriate intervention. Okay, it can improve the outcomes. So also early diagnosis helps prevent complications and allow parents to prepare emotionally and practically. So here the identification start from the antenatal period, especially ultrasonography at scheduled intervals, maternal serum screening test, amniocentesis for genetic test, chorionic villus sampling. These are the some of the antenatal period examination. So it can diagnose the congenital anomalies during the antenatal period itself. Then second one is the birth assessment. After the birth, we used to do normal physical assessment, including physical examination, Apgar score evaluation, and sometimes observation of the feeding pattern, breathing pattern, movement patterns. Okay, this can also help to identify the um, you know um, diagnosis of the congenital anomalies. Then third one is the screening program, newborn screening for metabolic disorder, otherwise genetic and chromosomal testing, hearing and vision screening. These are some of the investigation helpful to identify the congenital anomalies. So here we are going to see about congenital anomalies present particularly in respiratory system. Okay, the first one is the pulmonary hypoplasia. It's a part of lung is underdeveloped or absent. Um, um, so next one is the cystic adenomatous malformation. We can say CCAM. It's a condition where cyst or abnormal growth forms in the lungs and potentially impact lung function. Next, the third one is the lobar emphysema. It's nothing but it's over inflammation of one or more lobes of the lungs, leading to the respiratory distress in severe cases. And the fourth one is the pulmonary sequestration. It's a segment of lung tissue that does not connect to the normal airway system, so it receives its blood supply from an abnormal artery only. So maturation will not be proper here. And fifth one is the lung agenesis. Is nothing but absence of lung. Next one is the tracheoesophageal fistula. We can say it's a TEF. It's an abnormal connection between esophagus and trachea. It is having, so many types. One type is the Hatch type, which is very, common. So here both, trachea and the esophagus are getting connected. Next about congenital heart disease. So congenital heart disease also, so various types are available. I have put only some of the important condition. Number one is the septal defects. So we can say in short term VSD or ASD. VSD means the connection between the ventricle. Then ASD means the connection between the two atrium. Okay, and next one type is the coarctation of aorta. Here where the main large artery of the body called aorta is narrower than the normal. It means coarctation of aorta means nothing but aorta will be narrowed. So blood supply will be very poor to the body. Then fourth type is the tetralogy of Fallot. Okay, it's very common. So here tetra means actually four. Four conditions are connected. Here what is happening? The number one is the ventricular septal defect. So so here the connection between ventricles will be available. It means that the hole between two ventricles will be there. Then for second problem is overreading of the aorta. Aorta start Next, we will discuss about some of the common congenital neurological malformations, right? So here, the first one is the neural tube defects. We can say it's a entity. So it's happening due to failure of the neural tube closure, especially happening in the first 2 months of gestation period. So here, the first type under the neural tube defects is the spina bifida. Spina bifida is the condition classified into two categories. One is the myelomeningocele and meningocele. Among these two category, myelomeningocele is the most severe. Here nothing. What's happening here actually? Spinal cord content will be exposed outside. Okay, and anencephaly means it's the absence of major portion of the brain, skull, and scalp. Next type is the encephalocele. It's nothing but it's a sac-like protections of the brain and the membranes that covers its through and opening in the skull. Then under the congenital neurological malformations, hydrocephalus also coming. So actually hydrocephalus having two types. One is the acquired hydrocephalus. Second one is the congenital hydrocephalus. Acquired hydrocephalus means is happening due to any other other conditions causes accumulation of cerebrospinal fluid in the brain ventricles. Here congenital hydrocephalus means at birth itself excessive accumulation of spinal fluid in the brain ventricles happening. And last type is the Kyrie malformation. Here structural defect where cerebellar tissue extend to the spinal canal, which can obstruct the fluid flow. This is about disorders, I mean congenital disorders, which is related to the gastrointestinal system. So under the topic of mouth, cleft lip and cleft palate is happening. So we can see the picture is here discontinuation of the tissues happening, especially in the lip and palate. Next one is the tracheoesophageal fistula that we can see already. And next one is the pylori stenosis. It's happening in the stomach. And disorders of the intestine. Here some of the types are mentioned here. Number one is the intestinal obstruction, hernia, and intussusception, Hirschsprung disease, and anorectal malformations. Next, we are going to discuss about nursing management for the newborn who are affected by congenital malformations. Okay, so here comprehensive nursing care for infants with congenital malformations require vigilant monitoring, skilled technical care, and compassionate family support. So some of the following interventions form the foundation quality of nursing management. Meticulous nursing care during the neonatal period significantly impacts long-term outcome and quality of life of the infants with the congenital malformations also happens. So here the first one is the respiratory support. So we always have to maintain the airway patency and also ensure adequate breathing and monitor oxygen saturation continuously. Then second is the circulatory monitoring. Ensure circulatory stability, monitor always vital signs, and also assess the perfusion and color changes of the newborn. Then third one is the thermoregulation. Always neutral thermal environment should be maintained. Hypothermia absolutely prevented by using the radiant warmer or any other incubators. Then fourth one is the infection prevention. So due to the congenital anomalies, definitely newborn might be admitted in the NICU. So prevention of infection is a very major responsibility of the nurses. Here we need to implement strict aseptic techniques, hand hygiene technique. Sterile dressing should be always used while taking care of the newborn. Then fifth important care is the nutritional support. So growth monitoring and also very important under the nutrition support, we need to provide adequate nutrition and hydration through appropriate feeding methods and monitor intake of the newborn. Under the growth monitoring, always weight, length, head circumference should be tracked properly, and it should be monitored by comparing previous day and present day. Documentation growth patterns also very important. It can help to identify the early complications. We can also identify the growth pattern is happening properly or any other abnormal things found. And this about family education, psychological support. See, the diagnosis of the congenital malformation creates significant emotional distress for the families. So nurse has to serve as a primary source of information. It means we need to provide everything, all the information which is related to the newborn condition to the parents. We need to provide emotional support and also practical guidance during the challenge period is very important. Effective family centered care improves coping, and it promotes positive parent child bonding also. So here the first thing is the emotional support. We need to encourage the parents to express their fears, feelings, and their concern. At the same time, nurses has to provide and reassurance the emotional care without having any judgment. Next, parent education. We need to explain about nature of defect, treatment options, what are the outcome expectation are available, and what is the long term prognosis in simple term. Always this has to be explained by the nurses. Then home care training. Nurses has to teach feeding technique, medication administration, wound care, or any other complication should be recognized in the future days, or that should be explained by the nurses only. And resource connection. We need to refer to the counseling services if it is needed. We need to also give introduction with the support groups, and if it is possible, financial assistance can be arranged by any other society as per the economical status of the parents. Okay, so the very important thing, promoting bonding. So always nurses has to encourage skin to skin contact, participation in care activities, and also positive interactions with the parents. Help the parents see beyond the malformation to connect with their baby's unique personality and needs. Then this is about prevention. Okay, so preventive strategies means we need to first of all concentrate on folic acid supplementation only. During the annual period, it has to be administered 400 to 800 microgram per daily before conception, and during the first trimester also it should be administered to prevent the neural tip defects. And regular antenatal care should be provided, early booking should be done, and consistent checkup should be arranged. Then we can identify, otherwise detect any other congenital anomalies during the early period. And immunization. Okay, most probably if we are focusing on TT injections, we also focus if it is needed rubella vaccination before pregnancy. And this can prevent congenital rubella syndrome especially. And the fourth one is to avoid teratogenesis, nothing but some of the exposure of unwanted things like alcohol, tobacco, harmful medications, and environmental toxins. This should be avoided. Okay, this is very important. And at the last, nurses plays a vital role in taking care of the newborn. So we need to provide a holistic and family centered nursing management that addresses physical, emotional, and developmental needs of the newborn. It can increase the survival rate of the newborn. That's all about congenital malformation and nursing management of the newborn. Thank you so much for listening me.